Body contouring sounds very complicated and intimidating, but it doesn't have to be. That is why board-certified surgeon in plastic and reconstructive surgery, Dr. Bruce Landon, is back to explain what all that involves. Good morning, doctor. Good to see you.
Good morning. Thanks.
So let's talk about this. You said the two most commonly asked questions when it comes to body contouring is what, doctor?
What am I a candidate for?
Yeah.
And people know that we've got liposuction. They've typically, I don't know anybody who doesn't have a friend that perhaps has had liposuction.
Is it that popular,
it's
really?
So popular. And I think that the other thing that most people have heard about is tummy tuck.
Okay.
And people, there's a lot of misinformation out there. And I think that one of the most important thing about the consultation is determining what this particular client is a best candidate for, because clearly they can address different aspects of body contouring in a very different way.
Yeah. Well, and in my mind, when I picture body contouring, I think people can even lose weight and still not have the contour that they would like. Yeah. They need some help. This is where some of these procedures can come in.
Yeah. So typically liposuction, most people wish and hope that they're candidates for it because most people know that it's a slightly less invasive procedure and it has a little bit of a faster recuperation. But in order to be a good candidate and have a good outcome, it really is dependent upon having good quality to the skin envelope. So when we're determining candidacy for for liposuction, we have to have fairly good retained elasticity to the skin of whatever body part we might be removing some volume. And that's just absolutely critical for an outcome to meet with that patient's expectations.
Okay.
If there's a lot of skin excess, then essentially what you're doing is you're kind of popping or letting air out of the balloon, but the skin's incapable of accommodating to that. So it's going to fall very short of their expectations for outcome.
Is that when you would go towards the tummy tuck?
So that's when we would bump them to the tummy tuck, because the tummy tuck is really is a triple threat.
Okay.
It allows us to help restore the integrity of the muscle compartment. Then this would be more appropriate for women that have had children. And then of course it allows us to address the skin excess. And in addition, it allows us to provide an element of contouring because tummy tuck is now done in association with liposuction. If you'd have come 10 years ago, 20 years ago, it was always there were two distinct and they never really crossed paths. But nowadays we're able to get people much more balance out of the starting gate by doing a little bit of combination of both.
Is age a factor as well? I mean, do you typically see a certain age, for your patients?
The most critical component for determining candidacy for surgery is really the patient's pre-existing medical history. We've got elderly patients that really have kept themselves in fantastic shape from a cardiovascular standpoint and a pulmonary standpoint. They can be just as good a candidate for surgery as those people that are younger.
Okay. We have about a minute left. What is your take home when it comes to body, contouring? And again, this is something everybody is desiring for, right? How do you know when it's time to come in and actually do something about it?
Look, body contouring should be a last resort. The first resort should be weight management if that's a part of the problem. And remember, it doesn't necessarily have to be a part of the problem. You can get an exceedingly thin, fit woman who's had changes to her physique and body by virtue of the fact that she's had children. And that's really not correctable by continuing to go back and forth to the gym and diet. And it's not going to be responsive to dietary measures. Those people that are looking for these procedures to be a weight management tool are going to, in the long term, be disappointed because it's rare that they can take what we can offer to them surgically and keep it for any length of time because we haven't changed the mindset.
Yeah.
So behavioral changes, dietary changes, escalating their levels of physical activity should always be the very first steps in approaching their body contouring endeavors.
That's what we love when you're here because you manage expectations, you're realistic with your patients, and certainly I guess if people want to find out more to see if they are a candidate, you would encourage them to call, right?
Absolutely. We'd love to talk to them.
Yeah. There's a special offer as well, which this is for the essentially what we've been calling tummy tuck, right? $1,000 off there. But there is the number to call, the website to find out more. And again, thank you so much, Doctor. We look forward to seeing you again soon.
Thank you very much for having me.